So let's continue our discussion of the uses of augmentin. So I've got a final class of infections that can be treated with augmentin, and that is intestinal infections. There are more infections that we haven't mentioned that can be treated with augmentin. However, I think the list that we've done is pretty good, so we'll stop after we've discussed this class. So intestinal infections, so I've got multiple examples of intestinal infections here. The first one we've got here is famous, appendicitis. So we've all got this structure called the appendix that sticks off the side of the cecum, and hopefully you go through life and it never causes you any problems. It doesn't really do anything, but it doesn't cause any problems. However, in many people that isn't the case. In many people it does actually get infected at some point in their life. And that infection can be really dangerous. Sometimes it does just self-resolve by itself if they wait it out. It's often very, very painful at the time that it's infected, but often it would self-resolve if you waited, i.e. The immune system would fight it off by itself. But it can be very, very dangerous. It can perforate the appendix when it's infected, and then the infection will go into the peritoneal cavity and could cause life-threatening infection. So appendicitis can be very dangerous. So often we treat appendicitis. We don't just leave it to self-resolve. We treat it with antibiotics. And an antibiotic that could be used to treat it is augmentin. In my previous hospital, like biliary infections, intestinal infections were treated with augmentin. In the hospital that I now work at, the combination would be AMG rather than augmentin. That's the one they use for intra-abdominal infections, whether it's biliary or intestinal. So as I keep mentioning AMG, I thought I'd write this down. So this is 3 separate antibiotics. Unfortunately, no one has yet combined them into one injection. So it means the nurses have to give a separate injection for amoxicillin, a separate injection for metronidazole, and usually then a separate infusion for gentamicin. They don't usually give gentamicin as a single injection intravenously. Usually it has to be given as in a huge bag of fluids over half an hour or an hour or so. So this is a combination of antibiotics that is often used to treat intra-abdominal infections or infections of unknown origin. It would be very effective at that as well. Amoxicillin, you'll recognise that's the same antibiotic that is in augmentin, but there's no clavulanic acid here. And indeed, it's the clavulanic acid that makes augmentin much higher risk for causing clostridial colitis, which we're going to come on to later, but is one of the major risks of augmentin. So amoxicillin by itself is not high risk for causing that. Metronidazole is an antibiotic that hits anaerobic bacteria, and indeed is actually one of the few antibiotics that does actually kill Clostridium difficile, this thing that augmentin actually exacerbates. So this combination is not going to cause Clostridium difficile, therefore. And gentamicin is an incredibly powerful antibiotic that hits gram-negative bacteria. Its main side effect is that it's not good for your kidneys. As I mentioned earlier, it can cause AKIs in people that usually do self-resolve once the gentamicin has been stopped, but I have seen gentamicin cause AKI quite often, or at least what I think is probably gentamicin-related AKI. You can't obviously be sure. Often these people have come in incredibly ill, and then they get an AKI, and often people actually attribute it to the sepsis. They say it's because of the infection, but then actually when they came in, they were really, really sick. They were given the antibiotics and they got better. And when they came in really, really sick, they didn't have the AKI. And then a few days into their admission, after they've been given gentamicin, then they've suddenly got the AKI, the deterioration in the renal function. So in my opinion, I often look at the gentamicin with suspect there, that it may have been the gents that caused the AKI rather than the infection. But it does resolve after the gentamicin has stopped. But it's not brilliant. It is a risk with gentamicin. So as I say, there are pluses and minuses to every antibiotic choice that you make, every drug choice, in fact, that you make in medicine. And augmentin's plus is that it's unlikely to cause the kidney problems that this combination potentially might cause with the gentamicin being there. And this thing's plus is that it's much less likely to cause the clostridial infections or the drug-induced cholestasis that augmentin has as a risk. And again, it's the clavulonate in augmentin that makes it much higher risk for causing this drug-induced cholestasis as opposed to the amoxicillin. Amoxicillin isn't particularly high risk for causing drug-induced cholestasis. So overall, different hospitals use different antibiotics to treat things. In my previous hospital, intra-abdominal infections were treated with augmentin, whereas in my current hospital, they're treated with this. Both are effective at actually clearing the infections and it's debatable about which one you would prefer to use. But overall, we're discussing augmentin here, and augmentin is effective at all of these types of infections that we are looking at. So back to appendicitis then. So you can treat it with antibiotics. The problem with appendicitis is that, yes, the antibiotics will make it better, but it's very likely that when they go home afterwards, give it a few months, give it years maybe, they're probably going to get a recurrence at some point. Once you've had appendicitis once, you're probably going to get it again, and potentially again and again and again. So for that reason, often actually appendicitis is treated surgically. They have the appendix removed and then that solves the problem forever. But you can treat it just with antibiotics. If someone really doesn't want surgery, for example, then you can try just giving them antibiotics if they're reasonably well. If they're really, really sick, usually just take them for surgery, because once it's gone, then that's the problem dealt with. The infection site is gone. But more and more, actually, it is becoming something that is done to try and avoid the surgical operations, because surgical operations, of course, have complications as well. So appendicitis, it used to be the case that everyone with appendicitis got their appendix removed, whereas now there's a movement towards trying to treat more appendicitis with antibiotics and then see what happens in the future, see if they get recurrence, and obviously if they do get recurrence, then it's likely that they do need to have their appendix removed. If they never get a recurrence again, then that's a success. We've treated their one-off occurrence of appendicitis effectively with antibiotics. They didn't have any ill effect from that. And we've avoided them having to have an operation, getting a scar, and potentially getting adhesions from having had a surgical operation. So now let's move on and discuss diverticulitis. This is another type of intestinal infection. This usually affects older people. So it affects people who have a condition called diverticulosis. And this is something that develops with age. Another risk factor is obesity. So the larger your weight, the more likely you are to develop diverticulosis. So what is it? It is a condition that usually affects the colon and usually affects the sigmoid colon, which is the last part of the colon just before the rectum. And initially, when you're young, when you're a child and when you're a young adult, the colon is just a nice, smooth, cylindrical structure. What happens with age is that little outpouchings form, little small outpouchings form on the side of the sigmoid colon, and these outpouchings are called diverticuli, and the condition is then called sigmoid diverticulosis. Now, these diverticuli usually don't cause a problem. Usually they're asymptomatic. However, just like the appendix, which is an outpouching that we all have on the side of the cecum, these outpouchings, these diverticuli, they can become infected, and when that happens, it's called diverticulitis. So diverticulosis means that you have the diverticuli. It's the name for the condition of having the diverticuli. Diverticulitis is when one or more of these diverticuli become infected, and that causes horrific pain on the opposite side of the tummy, usually, to where the appendix pain is. So the appendix is in the right iliac fossa because that's where the appendix is. And diverticulitis, you feel the pain in the left iliac fossa because that's where the sigmoid colon usually is. So this infection, again, it may self-resolve if they sit it out, cope with the pain and the diarrhea, usually the main two symptoms, because the inflammation from the infection causes irritation, and then the colon starts moving much quicker, everything moves through much quicker, and therefore the water isn't absorbed properly, so you get diarrhea. However, it can, just like appendicitis, cause severe complications. It can perforate, the diverticuli that are infected can perforate, and therefore lead to peritonitis, which is a life-threatening infection. So therefore we do treat diverticulitis with antibiotics, And an antibiotic that could be used to treat it would be augmentin. Another example of antibiotics that could be used to treat it would be AMG. Of course, that's if the person's really, really ill and is in hospital and having intravenous antibiotics, they can have AMG, because gentamicin isn't an antibiotic that's available orally. Augmentin, the advantage is that it's both available orally and intravenously, so it can be used as a antibiotic for people who are less ill and can have their treatment at home, and an antibiotic that can be used for people who are very ill and need intravenous therapy in hospital, whereas this is just for people who are very ill and need intravenous therapy in hospital, because this one isn't available orally. These two are available in oral form. So augmentin is effective at treating diverticulitis. It'll make it get better. Of course, there is a massive risk that it will recur in the future, because the diverticula is still going to be there and can become infected again in the future. If people are getting recurrent diverticulitis again and again and again, then surgeons can consider removing the portion of the intestine that is affected by the diverticulae, and then either joining the two ends that are left of the bowel together directly, a primary anastomosis, or potentially if they can't actually stretch the two ends together, if there isn't enough give to be able to do that, then they might have to produce a stoma from the proximal end and then just close up the distal end to the rectum. So it would usually be the sigmoid colon that is affected by this, so it would be the sigmoid colon that is removed, and such an operation would be called a sigmoidectomy, or it has a name. When in the case where they remove it and close the rectum and bring the proximal end up to form an end stoma, I think that procedure is known as a Hartmann's procedure. If they just remove the sigmoid and then join the two ends together, I don't think it's called a Hartmann's in that case. I think they call it a sigmoidectomy with primary anastomosis in that case. But don't quote me on that. I'm no expert in general surgery. I only did one job there. So now let's move on and talk about enteritis and colitis. So I want to make sure that I'm very clear on what I mean by these two words, because there is potential for massive misunderstanding here. So enteritis means infection of the small bowel, colitis means infection of the large bowel. Now, we all get gastrointestinal infections from time to time. We catch contagious infections that can be viral infections usually, or sometimes you can get really bad ones that are bacterial infections. When people get those contagious infections, they usually affect the whole of the gastrointestinal tract. So they infect the stomach, they infect the small bowel, and they infect the large bowel as well. So it's the whole thing that's being infected, and it's a very mild infection usually. So we refer to that type of infection as gastroenteritis. So if you get a contagious virus that upsets your tummy, gives you some tummy pain, makes you feel nauseous, and gives you diarrhea for a few days until it resolves, that is gastroenteritis, and it may be caused by a virus, or worse forms can be caused by bacteria, such as Campylobacter and E. coli 0157 are the two main bacterial gastroenteritises that go around and people can catch. The bacterial ones usually last longer and take people much longer to get better, and the symptoms are usually more severe, worse abdominal pain, worse diarrhea. When we say enteritis or colitis, we are talking about much worse infections that are in those specific parts. And these usually are problems that affect older people. In fact, I'm just going to go off on a tangent for a second. So colitis, you can see this used in alternative places. So there are the inflammatory bowel disease conditions where the immune system starts attacking the commensals even though they're doing nothing wrong, or at least that's the theory of what's happening in inflammatory bowel disease, that the immune system has lost its tolerance for the commensals that live on the surface of the gut, and even though they're doing absolutely nothing wrong, they're doing what they should normally do, it starts attacking them, and therefore you get horrible inflammation occurring in the gut, because of course the immune system can't beat off the commensals, they're always going to be there, so it just goes on and on. So there is a horrible form of inflammatory bowel disease called ulcerative colitis that affects the colon, and the colon becomes really inflamed. So that's a type of colitis. That's not what we're talking about here, but it is another type of colitis. Also, in this video, we've talked about Clostridial colitis, and we're going to talk about that more later as a side effect of augmentin, a possible uncommon side effect of augmentin. And that's where Clostridium difficile overgrows in the colon and then starts to infect the colon. So that's another form of colitis. That's not what I'm meaning when I've put colitis here. So colitis without any sort of clarification and enteritis, these refer to infections of the small bowel or the colon respectively, where we don't necessarily know what bug is causing it. And this is the sort of situation when we use these diagnoses. So they usually occur in elderly people, and they come in with bad abdominal pain somewhere, and then they end up getting a CT scan, let's say, and that CT scan shows maybe that a part of their small bowel is really inflamed. It's so inflamed that you can see the inflammation on the CT scan. So when you can see the inflammation in the bowel on the CT scan, that means it's really, really bad. You know, if I took someone with gastroenteritis and CT scanned their tummy, you would not see the inflammation that the gastroenteritis is causing, because it's too mild to be able to be seen, to be able to be causing macroscopic changes that are visible on the CT scan. But when you've got such bad inflammation that it's visible on the CT scan, that's when we would make these diagnoses. So if it's in the small bowel that's occurring, we'd call it enteritis. If it's in the large bowel, we'd call it colitis. And what we think happened is the normal commensals that live in the gut have actually somehow been able to actually start infecting the wall of the gut. They've gone in and they've caused a massive infection and inflammation there, and so bad that it's now visible on the CT scan, and that causes horrific pain. Usually it'll cause diarrhea as well from the inflammation, increasing the gut motility, and it is obviously a dangerous infection. And why has that occurred? It usually occurs in elderly people that are therefore more susceptible to infections because their immune systems are less strong, they've got less physiological reserve, and also it commonly occurs in people who have got bad vascular disease. So the blood vessels, as you get older, get a disease called atherosclerosis, where their walls become narrower, the walls become thicker, and then the lumen of the blood vessel gets smaller. So when this happens in the coronary arteries, it causes coronary artery disease, angina, heart attacks. When it occurs in the blood vessels that supply the brain, it causes cerebrovascular disease, which eventually leads to a dementia called vascular dementia. It also leads to strokes. And it can also affect the blood vessels that supply the gut as well. And if some portion of gut has particularly bad vascular disease in the blood vessels that supply it, then that portion of gut isn't going to be as healthy. It's not going to be able to defend itself against bugs as much, and therefore it's going to be more at risk of the commensals managing to infect the wall, not being good friendly commensals anymore and starting to actually take liberties and infect the wall. So that, I think, is what people generally believe happens in these elderly people who get these severe enteritises and colitises. And in that case, when that's what we're diagnosing it as, we see the horrific inflammation on the CT scan and we think it is just the commensals that have started to infect the wall because they're elderly and frail and have vascular disease probably supplying in the blood vessels supplying the intestine. Then we call it these things, and that can be treated with augmentin, and there are other types of intra-abdominal intestinal infections. So I hope I've kind of made it clear when we actually clinically use these words. So if someone has a viral stomach flu, the correct term for that is gastroenteritis, viral gastroenteritis. It would not be, I would not advise you to call that an enteritis or a colitis. We use these terms in this clinical context that I've explained to you, usually when someone has come in with abdominal pain and then radiologically we see that they've got horrific inflammation in a section of their small bowel, and we term that enteritis, or a section of their large bowel, and we term that colitis. And you can be more specific as well. Usually the radiologist can work out exactly which bit of the bowel the inflammation is occurring in. So if it's the duodenum, we call that duodenitis. If it's the jejunum, we call that jejunitis. If it's the ileum, we'd call it ileitis. And as I say, these things can be treated with antibiotics, and hopefully the patient will get better. If the patient is really, really sick, then the surgeons can consider removing the affected portion of the bowel and then joining the two other ends together. That would obviously rely on the patient being fit enough for that operation. If they're incredibly elderly and frail, then they probably would continue with antibiotics on the grounds that the operation, they probably wouldn't survive the aftermath of the operation, wouldn't heal from it, and therefore it might actually worsen their chances rather than helping it.